Hi, I'm Dr. Sanjai Addla. I'm urologist, uro-oncologist and robotic surgeon at Apollo Cancer Institute, Apollo Health City, Jubilee Hills, Hyderabad. Thank you very much for tuning into Facebook Live on prostate cancer. September is a month of prostate cancer awareness. So I'm just going to talk about prostate cancer. How can we prevent it? How can we pick it up early? What are the treatment options? And how do we manage any problem that might arise during the time when somebody is on prostate cancer treatment? Let's start off with what is prostate cancer. Prostate is a gland that is there at the neck of the bladder. So where the water passage starts from the bladder and then comes outwards, that's where the prostate gland is. Normally, the secretions from the prostate are helpful in the earlier stages during the time of making it, almost provides the food for the sperm in the semen. Once that function is done, there isn't that much of a function later on in the life. So a cancer that develops in the prostate is a prostate cancer. Normally, it is an age-related cancer, but it is also a lifestyle-related cancer, and there is a small probability that it could be a genetic related cancer as well. So let's answer the third question first. So is prostate cancer hereditary? A small proportion, around 10 to 15% of prostate cancer is hereditary, in that you might have inherited it from your parents, mainly your father. So if your father has been diagnosed with prostate cancer, or if one of your brothers is diagnosed with cancer, or if they have been diagnosed with this cancer earlier would be when they are less than 60 years age, then there is a probability of prostate cancer being hereditary in your family. The other relevant history is of either your mom or your sister having a breast cancer, especially the one that are related to BRCA genes, or an early stage in earlier age ovarian cancer. Then all these are linked to similar kind of mutations which are in the BRCA gene. So it could be a hereditary prostate cancer. Why are we seeing more of prostate cancer? If we look at the cancer statistics compared to 1980s, we are seeing almost 2 to 3 fold, or 200 to 300% increase in the incidence of prostate cancer. And if you look at prominent cities like Delhi, Pune, Kerala, Thiruvananthapuram or Chennai, prostate cancer is the second commonest cancer that is picked up in men. So why are we seeing an increase in the prostate cancer incidence? As I said, prostate cancer is an age-related cancer. So people are surviving longer. So that could be one reason. The second one is that it is a lifestyle-related cancer. So prostate cancer, when I say it's lifestyle, we got to think of what all is included in the lifestyle. We can't control the genetic element. If we have inherited, we have inherited, whereas the lifestyle we can control. We can start off with the activity. The overall daily activity, the physical activity has reduced. Our lifestyle has become more sedentary. Majority of the things are delivered to our homes, so life has become sedentary. We know that lack of exercise, lack of physical activity increases obesity, and that is related to cancer. The second one is increased intake of high calorie diet. If we look at what was happening in 1980s to what is happening now, there is a lot higher caloric value of the food that we are intaking. So that is, we know, is related to it. The third, the proportion of animal meat protein that is there in our diets. We know that that has increased, and again that is related to prostate cancer incidence. And the last one is more processed food, more frozen food that is heated, recooked and eaten. We know that they are related to increased incidence of cancer. So these are all preventable. So as I said, actually hereditary cancer only accounts for around 10 to 15%. So there is 80 to 85% prostate cancer that is caused because of the lifestyle, which can be prevented, and it is within your own give to stop this prostate cancer coming to you or afflicting you. Okay, so prostate cancer is preventable to certain extent, but as I said, it's age related as well. As you grow older, there is a higher probability of prostate cancer developing in you. What are the symptoms of prostate cancer? How can we pick it up early, and what are the treatment options available? The prostate cancer, especially in the early stages, doesn't cause any symptoms. So by the time a patient has symptoms, which could be related to the cancer having spread to the bones or spread to the other organs, that's when it causes symptoms. So if you look at the worst symptom that anyone can present is bony pain, pain in the bones, not joints, bones, which is not settling with the painkillers. That could be related to an advanced cancer. And if you look at the other extreme, wherein early symptoms are just an enlargement of prostate cancer. So if someone is having problem passing urine more frequently, or waking up during the night time, especially if they happen to be in their 60s, then we know that these could be early signs of prostate cancer. There are some other late signs of prostate cancer, especially sudden onset of problem with sexual function or presence of blood in the urine. So I've told you the symptoms of early prostate cancer, I've told you the symptoms of late prostate cancer, but especially the early symptoms, this mainly picked up by screening rather than any symptoms. So what do I mean by that? So as I have said, the prostate symptoms are mainly related to non-cancerous enlargement of the prostate. So if you do happen to be in your 60s, which is one of the common age groups when you start developing this prostate cancer, and if you do have this symptom, seek help from a specialist, which happens to be commonly a urologist. And what they do is that they will examine your prostate, they will do a blood test called as a prostate specific antigen, and these should help us mainly to rule out whether you have a cancer or you do have a cancer. That will lead on to further investigations. Okay, so what is the lifetime probability? If you look at a Western population, America or England, 1 in 5 people or 1 in 6 people are diagnosed with cancer. Whereas if you look in India, you would think that probably around 1 in 20 people are diagnosed with prostate cancer. So the incidence of prostate cancer is small, i.e., even if you do happen to have symptoms, as I have said, early symptoms, there is a far higher probability that you do not have a prostate cancer. You just have a non-cancerous enlargement of your prostate. But it is better to be checked out so that any further investigations can be carried out. Then we go to the next stage. Let's say someone is diagnosed with prostate cancer. What are the treatment options? The straightforward answer would be depending on the stage of the cancer. So we tend to probably just stage them into 2 stages. If we say stage 1 is where the cancer is in the prostate or in and around the prostate, and the stage which would include stage 3 and 4 would be where the cancer has spread to the other organs or bone. In the first option, we can cure these patients. Majority of these patients are curable. Whereas in the second group, which I said stage 3 and 4, these patients, we cannot cure them. We can only control the disease. And currently, unfortunately, almost 75% of the patients who are diagnosed with prostate cancer in India come in stage 3 and 4, wherein we can only control the cancer. Let's look at the treatment options. What are the side effects and how do we manage the side effects? Treatment options would mainly be dependent on the stage of the cancer and what are the treatments that are on offer. So if you look at the stage of the cancer, as I said, in stage 1 and 2, wherein the cancer is in the prostate or in and around the prostate, we can potentially cure them. They can be cured either with surgery, which could be robotic assisted surgery, so that the patient has a very quick recovery. And when I say quick, if they have the surgery today, they'll generally go home the next day. So that is a very quick recovery, and I have had quite a lot of my patients who have gone back to work within 2 weeks after having undergone such a major surgery. So that's what robotic technology allows them. The second, which is equally good, is radiotherapy. That is, it could be a tomotherapy or a proton therapy, so that we can give the maximum chance of a cure from the cancer. So these are the curative options with respect to prostate cancer. Let's look at the side effect profile of them. The main side effect that tend to happen with either of them or one of them is problem with, first, urinary incontinence, urine leakage of leakage of urine. So for this one, the principal way to address is by improving your pelvic tone. So you will be taught how to do the pelvic floor exercises before you undergo the surgery, and you got to continue doing them immediately following the recovery from the surgery, and you got to do them for almost up to 6 months after surgery. The second side effect you tend to have is problem with sexual function. Again, this depends on what kind of a surgery you have had and to what extent the surgeon had to sacrifice the nerves that supply the erection so that he could ensure the cancer cure. Again, this can be treated in majority of the cases by giving medication. The third side effect is of problem with the hormone manipulation. The principal way we treat prostate cancer is by cutting off the male hormone supply in your body. But the side effects of that are mainly in that you lose your enthusiasm. So you will be mainly be feeling not weak, but you will be feeling lethargic. So you won't have the intuition to do anything, you won't have the urge to do anything. So lethargy is a principal complaint. Then the second complaint is feeling hot flushes. So you would be just sitting there, suddenly feeling hot, suddenly feeling cold. And then the third one is, as time goes by, losing the density of the bones. So the bones become thinner. And then the fourth bigger complaint is of weakness in the muscles, mainly the upper arm muscles and then the thigh muscles. So how do we address this? With respect to the hormone manipulation, which is cutting off the supply of male hormone to your body, that got to be given for as short a time period as required. That's one. Second, by keeping yourself active. So we always advise that you got to be doing at least 1 hour of walking or some sort of a strenuous exercise on a day-to-day basis. That's one. Second, we request the patients to do some weight bearing exercises. So rather than do minimal lifting, it would be around 5 to 10 kgs, but they got to lift it so that the bone is put under a bit of a pressure. Third, all the patients are advised to stop smoking. Fourth, follow the line of very healthy diet. Fifth, they are given vitamin D supplement so that we are able to maintain the bone thickness. Occasionally, we also give bone strengthening agents for these patients. The key thing is of having a healthy, active life. So even though you don't have the urge to do anything, we ask them to have a programmed activity. What does that mean is, they wake up at 6:30 in the morning, at 7:30 they go for a walk, at 8 o'clock they have a breakfast, at 9 o'clock. So in that way the whole day is programmed, and irrespective of whether they want to do anything or not, they can just do. It's 9 o'clock, so this is what I do. In that way they are overcoming the problem of urge to do anything. So what I have told you is with respect to the treatment options and then the side effects. The key emphasis that I got to tell you is about the management options that are available in patients who present in stage 3 or 4, wherein the cancer has spread to organs or to bones away from the prostate. There has been a huge amount of research that has gone into this. And earlier, let's say if a patient came to me about 3 years ago, I would have told them that they have got a lifespan of around 3 years. Now, for the options that we have, their lifespan has been doubled. So quite often, patients who are presenting in very late stage prostate cancer are alive up to 5 to 6 years. And that is because of the new options that are available for managing these patients. So we have discussed about the treatment options, the side effects, and how do we deal with the side effects. I'm going to talk about what are the treatment options available in Apollo Cancer Institute's Hyderabad, and what modifications we have done or what services we are offering during this COVID pandemic. All the treatment options that are available anywhere in the world with respect to cancer delivery are available in Apollo Cancer Institute. If you look at the technology with respect to the diagnosis, the latest diagnostic modalities including a PSMA PET is in-house. If you look at the histopathology, the most advanced and the best department with respect to histopathology, one of the premier histopathology departments in the country is in Apollo Hyderabad. The treatment options wise, we have got a tomotherapy, which is one of the most advanced way of delivering radiotherapy to the prostate, and we have got a robotic surgery which has been in place for the last 7 years, doing hundreds and thousands of these operations to ensure that we are well beyond our learning curve, and the standard of care we are delivering is amongst the best in the cancer institutions, not only in India, internationally. What are the services? How have we modified our service delivery during our COVID pandemic? Cancer doesn't wait for the COVID to settle. So we are seeing patients mainly on online platforms, wherein either by telephonic conversation or by using video consultations, especially through our Apollo 24/7 app or the video consultations, we are able to offer appointments not only to new patients, we are also following up our patients. The second, all the consultations that are there can be booked through our online, whether it is Ask Apollo or the Apollo website. These appointments can be booked, and the Apollo hospital as such is working fully and functional. Every department is functional. We are taking all the COVID precautions to ensure that the delivery of the care is safe, but the hospital as such is providing all the services. If you have any questions regarding the topic that we have discussed today, or if you want to seek an appointment, you can leave your comments in the comment section and I will try to come back to you. Thank you very much.